hip internal rotation positional isometrics. So if we're doing positional isometrics, or if you're doing positional isometrics, that means you've got hypermobility, and that just means you've got too big a gap between your active and passive range of motion in your hip internal rotation. So what I mean by that is this. We've obviously already discussed this, but just really quickly, with my wrist, I can actively get this far. That's my active range. My passive range is if I stretch, I've got about a 10 or 15 degree gap. That's normal. If you've got more than that, that can create some sort of safety issues for your body because your limb can get somewhere where your joints don't control it. So what positional isometrics is you're going to get into an internal rotation stretch of your hip to the end of your active range, and then you're going to push past it passively, so into a stretch 10 to 15 degrees more. Then you're going to do a rep. Once that rep is done, you're going to move another 10 or 15 degrees. And I'll show you as an example with, you know what, I'll actually show you with my elbow. So imagine that this is as far as I could actually actively get my elbow. But if I get my passive range, I could get my hand and actually push it all the way to here. This is too big a gap, obviously. So if this is my active range, what I would do then is I would get this hand and I would bring it up about 10 or 15 degrees past what here is my active range, 10 or 15 degrees past. I'd hold nice and still, and then I'll do my rep here. So I want to do a pales and then a rails contraction. So the pales contraction is the progressive angular isometric loading. So progressive just means the larger side of the angle. So this is the angle. As I'm doing this, this is getting larger. This is progressive. So progressive is pushing this way. Anyway, active range, passive range. Hold still. So pales is me trying to straighten my elbow, but I'm not going to go anywhere because I'm holding still. So I'm doing everything I can to straighten it. And then once that's done, I'm going to pull back the other way, which is me trying to come this way. But I'm going to hold still. So here we go. So this is my active range. I then pull in 10 or 15 degrees. Now I do my contraction here. Take a big breath, brace, pushing away, pushing away, pushing away, pushing away, and then 10 seconds. And then once that 10 seconds is up, I come back the other way as hard as I can for 10 seconds. Once that rep is done, have a relax, come back another 10 or 15 degrees. Do another rep, another 10 or 15 degrees, and just keep going 10 or 15 degrees each time until you get right to the end of your passive range. So now I'll show you the setup for the hip internal rotation. So hip internal rotation is my left leg. I'm just going to do this against the wall, right? I like to do it against the wall. You can do it against like any kind of wall, corner, door frame, doesn't matter. Just sit here, get your internal rotation active range, get your foot there, and now you're at the end of your active range. To get another 10 or 15 degree stretch, all you've got to do is either move your body that way or rotate it this way. So I'm going to rotate it. So this is my active range. If I rotate my body here, keep this still, I've now gone about a 10 or 15 degrees more. So this will be where you do your first rep. So here, you're going to try super hard. So you're going to take a big breath, brace your core, and now you're going to do a pales contraction, which is rotating this way. You're trying to get it straight back to normal, but there's a bloody wall in the way. I can't go anywhere. I'm doing this. I'm going to do this for 10 seconds. 4, 3, 2, 1. Then reverse direction. Try to rotate more. Try to get that foot off. Do everything you can to get more rotation, more rotation, more rotation. 4, 3, 2, 1. And then relax. Woo. Once you're relaxed, now you're going to stretch another 10 or 15 degrees. I can't do this because I don't have hypermobility, but you'll be able to just stretch a little bit more, rotate a little bit more. So just go 10 or 15 degrees more, do another rep, then do another 10 or 15 degrees, do another rep, and just keep doing that until you get to the end of your passive range of motion. The same way I did with my elbow. I started here, went there, 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 there. So the bigger your gap, the more reps you're going to do. The smaller your gap, the less reps you're going to do. And that is your hip internal rotation, positional isometrics. Now, a couple things to keep in mind are intensity drives adaptation. The harder you try, this should be literally 100% effort stuff. You should be shaking from effort while you're doing this. But the first week or two, that's not what your program's going to show. Your program might show 50%, 40%, 60%, 70%. in your first week or two. Do what the program says, because we don't want to make sure, obviously, we're not hurting ourselves along the way. We're going to slowly increase the intensity. But once it gets to 100%, 100% is where it's at. So just keep an eye, be mindful of what it says there. But once again, I know this is a new sort of exercise, a new sensation that you're supposed to be feeling with your body. So if you've got any questions at all, make sure that you shoot me a message and fire away. Enjoy your new hips.